Hey everybody, Dan here with Pain For You. Well, we made it through another week. It's Friday night. Good morning, Saturday, everybody. Today's topic is going to be showing versus telling. I'll get to that in a minute. So, sorry I haven't been getting outside. It snowed all day today. Another busy day here at the business. So, I'm going to take a couple breaths. Get yourself centered. Breathe in the calm. Exhale the nervousness. Breathe in the peace. Exhale the noise. Breathe in the safety. Exhale the fear. All right. So, when I say showing versus telling, the phrase that jumps to my mind is, you've heard actions speak louder than words, right? You've heard that phrase before, I'm sure. So how the heck does that relate to chronic pain, TMS, mind-body, syndrome, all this stuff? Well, as you know, if you've been watching my videos, I talk a lot about teaching the brain that we're safe. And I think there's two ways that we can do that. Obviously, there's the knowledge, the books, the information you get from the books and the podcasts and all that kind of stuff. And that knowledge is wonderful because it uses the intellect and logic and the cognitive thinking brain and an assessment that says, do my symptoms line up with what the characteristics of pain or symptoms are with TMS? That's a logical analysis, and we can use that information. But to me, when we reassure ourselves and we tell ourselves, hey, Dan, it's okay, you've done the assessments, you've studied the TMS information out there, you've watched lots of information, you truly understand it, and this absolutely applies to you, you're telling your brain that you're okay. And that will absolutely be beneficial. And it will get you farther along on the journey here. But that intellect and the logic sometimes doesn't sink into the subconscious, right? It's the prefrontal cortex. And if you want to communicate with the subconscious, that's where the showing comes into play. So, telling would be like walking around the house all day long going, I'm safe, I'm safe, I'm safe, I'm safe. But you're doing it with a tense body, fearful, as you're, in between I'm safe, you're thinking, but what if it's not TMS? What if? I'm worried about what's my future going to be like. I'm safe, I'm safe, I'm safe. You're trying to tell your brain that, that you're safe and that you're okay. But is the brain going to believe you if you're still walking around all tense and tight and shallow breathing? Probably not, because the subconscious is paying attention. And so you're telling yourself that you're safe, but you're not showing your brain and your subconscious and your nervous system that you're safe, because you're still acting like you're not. So showing versus telling, what I mean by that is, let's combine the intellect with the body. And we can use our physiology to teach our brain that we're okay. So if you're going to reassure yourself and use the cognitive, the intellect to tell yourself that you're okay, please combine that with a nice, slow, relaxed breathing. Let your body relax. Let your shoulders drop. If your shoulders are stuck to your ears because you're so tense, your muscles are always like bound up tight, it's a message that says to your brain, I'm in danger. Now it's a two-way street. If you're fearfully thinking, your body's going to tense up naturally. But we can reverse that and say, okay, well, if I can intentionally relax my body and deepen my breathing, I will be showing my brain and my subconscious that I'm actually safe. Because if you're truly in danger, Trust me. You wouldn't be breathing slowly and have a relaxed body. So, there's telling and there's showing. Telling is very useful because we want the intellect to buy into and believe the analysis we've done and the self-diagnosis we've done that says, yep, I have TMS. I saw myself written on every page of the book. But if you're still walking around freaking out, believing you're thinking, and your body's all tense, you're only getting halfway there. So showing versus telling. Showing yourself through how you're carrying your body. And how do we do this? We've got to become aware. We need awareness as the overlay to this whole thing, which says, am I aware of the fact that my body is tense? And if so, we need to consciously, with intention, slow it down, let it relax, and you will be showing the brain that you're okay. And when you combine the intellect with the showing of the body that you're breathing slowly, calmly, you're not buying into your catastrophic thinking, you're not looking for reasons that TMS does not apply to you, you're looking for reasons that it does, or you're just reassuring you that you've already done that analysis and the case is closed. Jury's reached a verdict. Investigation is done. So, ask yourself, are you showing yourself that you're safe, or are you just trying to tell yourself you're safe? Is your body language communicating a message of safety to your brain and your subconscious? Do you feel safe? Or are you just saying it because you think if you say it enough, you're going to believe it? But again, your brain's going to buy into it and accept your safety in the moment a lot more if you're actually breathing and relaxed and portraying a body and a state of being that says I'm safe. So you could probably go around this one several more times, but that's the core message. Are you showing or telling yourself that you're safe? If you're telling, great, that's a good start. But if you're not showing yourself that you're safe with your state of, the state of your body, if you're all tense, then you're only getting halfway there. Your brain may not buy it, may not believe it. So combine the cognitive intelligence side with the physical soothing side. Your brain's going to grab onto that a lot more quick. And when it does start to believe that you're safe, because you're showing it and telling it, the symptoms are going to fade quicker. So ask yourself, am I showing or telling? Do both. You'll get there faster. So, love you guys and gals. Happy weekend. Welcome to Saturday. And I will see you tomorrow.